Welcome back to Holistic Healing Association. Today we have a very special episode, and I just wanted to touch base with everyone. This is a place for safety. And after this episode, if you need to reach out, please, I welcome you to do so. Today we'll be talking about sexual trauma. Sexual abuse is very common, and it's very common to come from someone we know, a friend, a neighbor, a family member, and we were often threatened afterwards not to tell anyone. It can leave us feeling deep shame, disgust, anxiety, great anger, depression, emotionally shut down, emotional numbness, hypervigilant. It can cause us to dissociate. We need to feel safe again, to be able to come back into our bodies and to feel whole, to feel empowered. And this is what healing can do for us. Today I have with me Dr. Nick, who is a psychologist and trained in somatic experiencing. He specializes in sexual trauma. Thank you so much, Dr. Nick, for joining us.
Hi, thank you. So my name is Dr. Nick Monzon. I'm located in San Diego, California. I recently opened a group therapy practice that's focused primarily on trauma. So that it's called the Integrative Trauma Collective. And there we focus on healing trauma through both a bottom-up, body-focused approach and top-down traditional talk therapy approach. I've been licensed as a psychologist in California since 2024, and I've been working in this field since 2012.
Okay, thank you. And can you tell us what is trauma?
So, trauma, just as a very basic definition, trauma is any experience that is too fast, too strong, too powerful, that overwhelms our body, our nervous system, our mind. So, when we break down the definition of trauma in that sense, really, when we look at events, a lot of things can cause traumatic energy, traumatic responses. Sometimes they do, sometimes they don't. It really depends on our body's experience of the trauma and our limitations within our body. And when thinking about trauma, trauma is, in essence, something that is a felt experience more than a mental, psychological experience. What I mean by that is that trauma lives in the body first. Our body has a natural automatic reaction to certain experiences when we think about, say, fight, flight, and freeze. Because of that, our body responds to experiences, to environmental stimuli first, before our brain has time to catch up and say, oh, what is going on here? When I think about trauma, I think about perhaps walking through the woods late at night and suddenly I see a bear. I'm not going to stop and think, oh, that bear might be hungry. No, my body is going to be running. My body is going to be fighting for survival. And that traumatic experience is then going to be embedded in my body and live there. And this is what I mean when I say that trauma lives in the body first before we cognitively think about it.
Okay, thank you. And what led you into working with people with trauma?
So when I was in my undergraduate college at Cal State Long Beach, I volunteered at the Greater Long Beach Rape Crisis Unit, Rape Crisis Hotline Unit for 1 year, and that was in 2012. And I was trained to respond to phone calls from people who had just survived a sexual assault and occasionally go with them to the hospitals to undergo the rape kit, to do medical examination to make sure that there was no lasting damage. And that experience really highlighted for me the importance of healing trauma because I would get these calls very, very often. Sadly, unfortunately, this is an experience that so many people have. And from there, where my career led was I started to do research. My first research study was looking at how to treat nightmares related to sexual assault survivors. From there, I decided that I wanted to move away from research and focus more on clients, treating people in person, face to face. It was there that I started to get more experience working with trauma. And I've worked with community mental health organizations, I've worked in different hospitals, I've worked in correctional facilities and prisons. I've worked with people who have experienced more trauma than they could ever possibly share with me across different populations, different ages, different settings. And it's these experiences that allow me to come into the room with my expertise and help people who have just experienced the worst thing in their life.
Okay. And what led you into somatic experiencing?
When I was doing my internship, I did my internship at the Wright Institute Los Angeles, a very wonderful nonprofit who focused on providing low-cost mental health treatment to the community. And when I was there, my mentor and supervisor at the time sat me down and said, "Hey, if you want to treat trauma, like really seriously treat trauma, this is the training that you're going to have to use." He he was a trainer for the SE workshops as well, and really opened me up to this possibility and this idea that trauma is a body felt experience first. When I was in school, when I was doing my education, it was all talk therapy. It was all discussing, how we can talk our way out of certain experiences. But when I meet with clients and when I've met with clients in the past, talking sometimes doesn't work. I can talk to someone, but if they're in a more dissociated state, for example, or if they're having a panic attack, my words aren't going to really matter. And this supervisor, am I allowed to say his name?
Okay, whatever you want to say is welcome here.
Yeah. So, Dr. Chris Walling. So, thank you, Dr. Walling. He really led me down this path of understanding that trauma is a deep body felt experience first. And it was with that understanding and with that training that I started to notice myself being more present and able to help more people in the room. So that's really what led me to somatic experiencing, which I'm still very and a very active member of. I now assist the different trainings here in San Diego.
And what do you mean by assist?
So assisting during trainings is uh, helping out with the facilitator, the lead trainer, in terms of questions. Sometimes I'll come up and I'll do demonstrations about different techniques. When the students break off into their work groups to practice, I'm the one that watches over them, making sure that they're doing the different exercises and interventions properly, and also as a container. So when we think about trauma, trauma is a felt experience of being deeply unsafe. One of my primary roles as an assistant is to have a container where the students can come in, experience their trauma in a way that doesn't overwhelm them. And really that's one of the best experiences I think that I've gotten from being an assistant is being able to provide a container for so many different people.
Okay, well, thank you. And when a client comes in with a sexual trauma, with somatic experiencing, how do you help them feel safe? I know with embodied processing, what we need to do is first build a rapport with the client, starting them into resourcing
Yeah.
so that they have a sense of safety and build capacity.
Yeah.
Very slowly, very gradually, letting them set their own pace.
Yeah.
Almost like turning on a bit of a tap, just letting them feel a little bit of emotions at a time,
Mhm.
very gradually, and doing it very safely and allowing their body to be able to feel safe.
Yes.
Because there are some methods out there for trauma that it just gets people to go dive right in. And that can actually cause a lot more damage then it can good. What do you do?
So I love that you mentioned that as well. For my doctoral dissertation, I looked at PTSD among crime scene investigators and found that the ones that were forced to talk about their trauma actually developed more PTSD symptoms. So when I have a client that comes into my office or into my Zoom room for the first time, I'm very upfront, especially because I know that I am male and a lot of my clients are female. And unfortunately, the statistics show that females are more likely to be sexually assaulted by a male. So with this experience, I need to make sure that I'm doing everything in my power to make sure that this client comes in and feels safe with me because they might have had an experience with a male that was deeply unsafe. So I tell clients when they first walk in, I say, I don't want you to tell me about the worst thing that happened to you. Not right now, because we just met. I need to earn your trust, and we'll do that very slowly. I tell them we will go at a pace that is the most comfortable for you, the slowest possible pace that is comfortable for you. And my first couple sessions with clients, especially new clients with this experience, I focus so much on rapport building. Because if they don't feel safe with me, if they don't feel comfortable with me, then there's no healing that can happen. It's going to be very, very detrimental to them if they don't feel safe with me. So we start by inviting them to orient. Orienting is looking around the space, looking around their environment. And I often work on Zoom, and I do this for a very specific reason with my sexual trauma survivors, is because their space typically is safe. Their environment is safe. Their room is safe. If they're in an environment that they were assaulted in, then I will see them in a different space. But for the most part, they're in their room, they're in a space that's comfortable for them, they can control it. And I'll invite them to look around the room in a very slow manner because when we are in danger, when we are in a traumatic experience, our eyes dart very quickly in a scanning motion to look for danger. Instead, what I have clients do, and this is a foundational part of SE, is to look around the room out of curiosity. Instead of scanning for danger, can we scan for something that makes you happy? And I'll invite that into the, the questioning. I'll say, can you look around your room and just notice when something comes across your eyes that makes you smile? And I'm looking around my room right now, and where I'm a very big Disney fan, being here in SoCal, if you can't see the little Mickey
Oh, I
behind me,
see.
but there's some Mickey stuff that my wife put up, and for me, it brings a immediate sense of relaxation, an immediate sense of kind of slowing down and joy, and that's exactly what I'm looking for with clients. Let's find something in your environment that helps you slow down, that helps you relax, that brings a sense of joy. One of the most terrible things about traumatic experiences is that oftentimes it takes away our experience of joy. We focus so closely and so heavily on the negative experiences, the anxiety, the stress, the nightmares. But something that we don't focus on as often is the lack of joy. When we are in a fight, flight, hyper aroused experience, or maybe even hypo aroused, right, going down, being frozen, being more numb, there's very little joy that can come in. So, first way to establish safety within the room is to notice what brings us relaxation, what brings us joy, what brings us happiness. And I will specifically ask the client, how do you know that your body is feeling relaxed? This is not a question that we often get asked. And oftentimes the client goes, oh, well, I'm not feeling my heart as much. Great, great. Let's start there.
I do.
What
I ask
is,
the same question actually in sessions. That's funny.
yeah, it's like, what is not being able to feel your heart race feel like? And with SE, it's an empowerment focused modality. The entire foundation is around client empowerment. That's why it's so important for trauma. And for clients, this feeling of, oh, I can come back into my body now. It's not purely unsafe to come back. I think when we start working, especially with survivors of sexual trauma, noticing that the body can feel safe again is one of the purest forms of healing. And it's something that I strive to provide for clients, especially within the first 3, 4, 5 sessions, is to really help them know that in this space with me, they are not in danger.
And even after sessions for homework would be to find glimmers,
Yeah, exactly.
small moments that can make us feel safe and some sense of peace or joy in our body.
Mhm.
So it could be a beautiful sunset, a warm cup of tea. It could be a close friend, whatever that sense of comfort, that sense of safety, and embracing it. And if there's activities, for example, meditation that gives you a sense of safety, it could be a, even a comedy show.
Yeah.
I know when I was pregnant and I was really struggling, comedy shows. That was it for me.
Yep. Yeah.
So it's
Yeah.
just little glimmers, just little moments that going in my hot tub again, a little glimmer. What are your glimmers?
Oh. So I have 4 cats with my wife, and they all have these little different personalities, and I think for me, just being able to interact with them. My One of my cats will oftentimes come up here to my this is where I see clients. He'll come up and he'll just lay on me, especially if he kind of just misses me. That's something that always brings me so much joy, and it's such a reminder too of being more mindful. A key foundation of SE is mindfulness, right? Being in the moment and being able to notice where glimmers are in our world, but also to sit with them. Oftentimes, I think all of us are guilty of this at some point, is just being on our phone. And when I know that I've had a difficult day and I need to reconnect to myself, I will put on my favorite show, which is The Simpsons. And I will put on an episode from, the earlier seasons or sometimes the newer seasons as well, depending on what I want. And just putting down my phone, sitting with my wife, and just laughing. Laughter is one of the best medicines that we have, especially with traumatic energy, but also the experience of laughing with someone else. So I always tell clients, especially in early sessions, as homework, I don't assign homework too much. It's more of like a, try this out if you want to.
Mhm.
I asked them to laugh with someone and notice what it's like to laugh alongside someone. One of the best experiences that we have that brings us back down to baseline and is so healing is a felt sense of connection and community.
I
My
agree.
wife and I both love The Simpsons. That was one of the things that she saw in my dating profile that got us to match. And it's a show that so many of us have a connection with. And when I'm watching it, I feel into that connective tissue of it's not just my favorite show, it's the favorite show of millions of people around the world. And so many people have laughed to this show. For me, that provides such a strong glimmer of knowing I'm not alone. And I think when we experience trauma, but especially sexual trauma, there's such a deep felt sense of loneliness, of disconnection, of I do not belong here anymore. There's something fundamentally wrong or fundamentally broken with me now. And focusing on glimmers, even just very, very gently, very slowly throughout the day, is a way that we can reconnect to ourselves and reconnect to other people. So for me, glimmers are all about connection. How do I feel connected to my spouse, my cats, my friends, the world itself? For me, that's where the glimmers are.
I agree 100%. I know I'm in a community and we're all healing together. And man, what a difference does it make to heal in a community? And I know ancient tribes,
Yeah.
when there was, say, someone was struggling, they would actually thank the person. And they would say, your healing is our healing. And they would have ceremonies, and there would be music, and there'd be dancing, and they would come together as a community and support the person. And in our society, everything's isolated, everyone's to themselves.
Yeah.
And that is not a healthy way to heal. You
No.
heal in community, you heal in connection.
Yeah.
And love, true love,
Yeah.
can also be a source to help us heal.
Yep. Humans are, in our core, in our essence, we are creatures of connection. We crave it. We need it. I had a professor once tell me, even if you were on a deserted island stuck, you're still not alone because there's people that live in your mind. There's memories of friends, memories of loved ones. You're never alone in this world. And I think coming back to community, coming back to that felt sense of a tribe is so important for healing trauma, especially right after it happens. We need that community around us to fall back on, to allow to help heal us. And unfortunately, a lot of us don't.
I agree. I know after my trauma, um, I was abused, and like I had, for other factors, I had so much shame, so much deep shame, and I was self-isolating.
Mhm.
And coming into community, it helps so much.
Yeah.
Like just significantly, it just, yeah, like it impacts your life, and it helps the healing significantly. What percentage of people have sexual trauma, and how does it impact them?
Yeah. So this is a question that I've been researching for a long time. The numbers are at least 25% for women, at least 25%.
That's huge.
That's massive. It's massive. A massive, terrible problem. The worst part of it, though, is the ones that don't get reported. These are just the ones that are shared. There's probably so many more that never get shared, never get talked about, that are left in silence. And that's terrifying. That's such a scary.
That is terrifying,
Oh,
because that's a huge percentage already. And how many
yeah,
people is this happening to? And they're too afraid or too ashamed or too disgusted to come
yeah.
and tell.
So for women, the stats are at least 25%. For men, I believe the last time I checked, it was 1 in 7. So not as bad, but also again, men don't share this. When I worked for the rape crisis advocacy team unit that was in Greater Long Beach, I only had one call from someone that was male, socialized male, and
I'm glad. I bet he was glad to talk to you.
he was very glad to have another male on the phone. Actually, I was told this. I don't know how true it is, but I was told that I was the first male that they ever accepted as part of the program. And for me, that felt like such a huge honor, but also to be able to be there for this gentleman who was so scared. Thinking about males in general, males are taught to be strong, to not cry, to never share their feelings. So even though I know that this number of maybe 1 in 7, 1 in 8 is low, I imagine that it's the same exact thing of more males are experiencing this and they're not coming forward, they're not saying anything because of the shame. And I want to be very clear because I'm aware of my own privilege being male in this particular situation. Not saying that any gender has it worse or that any gender has, you know, a different experience with it. I'm looking at this problem as just a terrible experience and a terrible statistic for both sides.
I agree 100%. Because even 1% is way too much,
Too much.
because it's horrific.
Yeah.
And how does it impact a person?
Oh, that's a big question. So let me break this down into the nervous system. So the nervous system has a few different states. So there's fight, flight, and when we get stuck in fight, flight, it's called hyperarousal. And when we're in this state, we're constantly searching for danger. We're constantly searching for something that is threatening. And this can look like always scanning the environment. This can look like never trusting anyone. This can look like staying inside of our home, even because we don't want to go outside. This can look like unchecked anger, unchecked stress. Um, I've had clients that come in and they're stuck on, and for them, it's so scary because everything is threatening. They're convinced that if they let their guard down, they will be hurt again. So that's one option. The other option is to go the opposite way of hypoarousal. And this is when our nervous system gets stuck in the freeze fawn. And for clients that come to me stuck in hypoarousal, this looks like being shut down. This looks like self-isolation, not because they're afraid of other people, but more because they just can't interact with anyone. Is this looks like being so disconnected from their body that oftentimes they neglect their own needs. I've had clients who self-harm because of this, or not eat for days, not drink water for days, not because they hate themselves, but because their body is just so shut down that they just don't care.
And this can cause mental health struggles.
Oh, 100%. Yeah, 100%. This can cause mental health struggles such as depression, suicidal thoughts. Work very often with a lot of self-harm, especially with people who have experienced sexual trauma early on. Um, this can also impact our daily life, our daily functioning in terms of connection with friends, with family, but also with our loved ones as well. This sexual trauma experience can really impact intimacy on such a deep, profound level for clients, and that can be a very terrifying experience.
How can it impact a marriage?
So I'm thinking about a client I was seeing a little while ago, and when I was working with one of the spouses, they shared that they hadn't been physically intimate in about 5 years. And it was not because of a lack of desire, it was because of a lack of felt safety within the body. Unfortunately, one of the spouses had been sexually assaulted as a child, and there was this experience of the attacker being on top of them and them being stuck, not having safety, not being able to run away. And this felt experience got stuck within her nervous system and within her body. And whenever she was put in a situation that was similar, her mind went, "Oh, last time I felt this, I was in danger. Last time I felt this, I was suffocating, I was hurting, there was something seriously wrong. I cannot do this again." So with this couple, what we did was we started very, very slowly and titrated very, very gently. We began with just sitting next to each other and noticing what's it like to sit next to your spouse and know that nothing needs to happen. Nothing sexual needs to happen, nothing big needs to happen. You're just sitting with your spouse. And notice coming back into the body, what feels safe about just being able to sit there, knowing that you have control. And in this situation, with every situation with trauma, it's all about empowering the client. So we often think about sex as being one thing, physical intimacy as being one thing. But physical intimacy can be so many things. It can be a hug, it can be a massage, it can be dancing.
Could be holding hands.
Exactly. It doesn't have to be something that can be so triggering. So with the client, I ask them, what do you want physical intimacy to look like right now, today? Not in the future, not back then when you first got married, but how do you want it to look like today? And they said, well, I want to be able to walk with my husband and just hold his hand. So that's what we worked on. We worked on getting her to a point where she could feel safe just holding her husband's hand, knowing that nothing else needs to happen. And over time, what developed was the client was able to feel more comfortable and more safe with physical intimacy, with non-sexual physical intimacy. And let me be clear. And helping the client feel like they have control over the situation, I think was the most important part of this, was that the spouse was able to say, yes, we will do this at your pace. I'm not in any rush. We will do this on your pace. Please take as much time as you need, which gave permission for my client to say, oh, there's no shame in this anymore. I think oftentimes we
Creating
get
safety.
stuck in this, yeah, yeah. We get stuck in this shame cycle of I should be able to do this. I should be able to have this experience, but when our body's saying no, we need to listen to that. We need to listen to when our body's saying not like this, not at this pace.
And that
Let's
would
slow.
apply for anyone. Like, for example, like when people have been sexually assaulted, they may, if they're going to be sexually like intimate, they may dissociate.
Yeah,
They may feel terrified. So many emotions can possibly come up, just
yeah,
like your client. And what a great technique. Just creating that safety and starting with holding a hand or whatever, or hand on the shoulder or a hug or whatever that client is ready for,
yeah.
and letting them set their own pace.
I will add that, say, for example, if this client wasn't ready to physically hold her husband's hand, what we can also do is have them just imagine it. Imagine reaching for the husband's hand and then noticing in the body, okay, when does it get to be too much? At what closeness does the body go, oh, that's it? Because when we imagine movement, actually the neurons in our brain function and they fire off as if we're actually moving. So this was a way that I've used this with other clients. This was a way that we could have them envision what intimacy, non-sexual intimacy, what that can look like for them and what they want it to look like for them.
Yes, I agree. And what percentage of people know the person that caused them this harm?
Again, I'm not sure of the exact statistic because I think that it's very, especially that is going to be very much underreported. Thinking about my own clients, right? I've worked in hospitals, community mental health, prisons, and I would say probably about 70%
So
knew.
pretty high.
Yeah, it's very, very high, especially in childhood. I work primarily now with early sexual assault, early sexual trauma, and a lot of my clients knew the perpetrator. They were a friend of the family. They were a family member. They were a neighbor. And that's what makes it so scary and so damaging is that these people that are supposed to keep us safe don't. And as a
There's a
child,
face to it. It's not just a stranger.
yeah, exactly. When there's a face to it, it makes it so much harder.
A lot more scary and a lot less safe.
Yeah.
Because now who can you trust?
And as a child, we rely so heavily on adults, the people around us to keep us safe. And when we can't rely on them anymore, how terrifying that is.
And as a
How,
child, we can blame ourselves
yeah,
as because
which
it
often
can't be a mom
happens.
or dad's fault, or it can't be our uncles or aunts, our grandparents. It must be ours. And
Yeah,
then there's great shame that comes along with that, that we're carried on.
yeah,
And
yeah.
how do you work with shame? Because there's great shame that comes with sexual trauma.
So shame is one of those experiences that comes up very often, especially with this population, with this type of trauma. And I'm very, very careful when it comes to working with shame. Shame is one of those experiences that I like to refer to it as bubblegum, in that shame gets stuck to different emotional expressions. And as I have mentioned, I work primarily with women. And what I have found with my female clients is that the shame is so tied to their sense of anger. When their anger starts to come up, when they start to get frustrated or get angry, the shame comes in and says, nope, remember, this is your fault. You can't be mad about this. So what I do, and SE was developed by Dr. Peter Levine, and I want to give him credit because this is his analogy, it's not mine. But with shame, we stretch it like taffy. We stretch it very, very gently and very slowly. If I come in and say, well, no, it's not your fault. It's the other person's fault. That's not going to land. That's not really going to help. So instead is I work with the client's sense of shame and I titrate their experience of it. I have them experience maybe 5% of the shame, and then we come out. We go somewhere else. And then maybe a couple of minutes later, I'll come back and say, you know what, let's come back to this. Now let's go to about 6%. Because I want them to experience the shame without it shutting them down. The way that I think about shame and conceptualize shame in my mind is it leads to a pretty quick freeze response. Because shame tells our body and it tells our mind whatever we're doing is wrong. Whatever we're doing is going to get us kicked us out of the tribe. It's gonna make it so that we get abandoned or rejected, or someone's gonna be mad. So someone will be mad at us. So I'm very careful with when the freeze goes into shame, and then the vice versa. When we're working with shame, how do we stop it from going into freeze? So for shame, especially with my sexual trauma survivors, I have them imagine the shame and then we find it within their body. And I only have them work and imagine the outskirts of this shame. They're very used to feeling it, but I don't want them to deeply experience it. I just want them to notice it. What's it like to just notice that the shame is there, but knowing that you don't have to do anything about it? You can just let it be there. Usually shame is this experience of I need to fix something. I need to fix something or I need to stop something. And when we prevent ourselves from going, okay, this is what's causing the shame, let me fix it, and instead just allow the shame to be there, suddenly it becomes a lot less powerful. It becomes a lot less potent. And then inviting the client again, okay, now let's come back into the body and let's notice where this shame was and just be curious. Has anything shifted? Is the shame at that same intensity, that same level, or has it gone a little bit lower? Is it a little bit less powerful? And especially with sexual trauma, boundary work when it comes to shame, and recognizing that this boundary is mine. And someone coming in, someone violating that boundary is not my doing. It's that person's doing. And how can we separate someone's felt experience of shame from the person that attacked them? Oftentimes we blame ourselves for the attack, for the trauma, but no one asks for this. No one has ever asked to be violated and hurt in this way. So being able to separate that experience for clients is a very healing.
I know I've worked with a lot of shame personally myself and with others. I believe many of us, if we're honest with ourselves, have some type of shame.
Yeah.
But yeah, no, I agree. Very slowly, very gradually. I've had sessions when I first started, and to the point that I had felt like I was come on strong and fast, that I was going to vomit. It
Yeah.
was like disgust, and that
Yeah.
was shame. I remember once I was running around in a session, and all of a sudden I just kept on feeling like I was gonna vomit to the point I dropped to my knees. Um, so yes, going very slow
Yes,
is
it's very,
key. Because you don't want to go through that because it's very slow and it's like turning on the tap, right? A little bit of shame and go back into a resource. A little bit of shame and go back into a resource. Very slowly, very gradually. And it takes its time,
yeah,
right? And again, you said fix it. I was the fix it mentality girl. I'm feeling shame. I have to prove myself. I'm gonna work, 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 work,
yep,
right? I'm gonna prove my worth.
yeah,
But we all have human worth.
inherently.
And we don't need to do anything to prove it.
No,
We have human worth because we're humans. Like,
exactly. And there's another piece of psychoeducation that I bring in because oftentimes we get embarrassed and we have shame over how we responded to a traumatic event, especially if we freeze. If we fight and we lose, there's some felt honor in that, especially among males. But if you freeze, that's seen as shameful. And that's seen as something that was a choice. But our
but
nervous
it's not a
system does not,
choice.
nope, our nervous system does not ask us, like, hey, what do you want to do? No. If I'm walking through the woods and a bear runs out in front of me, I'm gonna run. My body's gonna run without telling me, like, hey, what do you want to do? So informing and teaching these clients to not only understand but to feel that my body did what it needed to do to stay safe. Our nervous system is only worried about waking up the following morning.
That's right. And we may not have been able to run and may not have been able to fight. And
Yeah,
so that is how our body reacted,
yeah.
right? And there's no shame in that. And lots of times we can understand that here, but in our bodies we don't. And it takes time.
Yeah.
But that's why somatics is so good, is
Yep.
because it really helps process our emotions, but also gives us deeper understanding in our body and helps us understand ourselves better. Do you find that?
Oh, yeah, 100%. After going through the SE training and getting sessions and understanding it more and doing it on myself and getting sessions with wonderful providers, I was finally able to break through a trauma barrier and finally allow joy and happiness back into my life and into my world. I would not have been able to connect with my wife in the way that we did if I hadn't gone through the training, and I might be single to this day if I never did it. So I credit SE and this experience with fundamentally changing who I am as a person and allowing joy and happiness to come in. That was something that for the longest time it was offline. It was not something that I ever really allowed in. It was something that I feigned. I pretended. A lot of us I think get really used to walking around with a fake smile, trying to just pretend that things are okay, but SE actually allows us to feel that happiness and to deeply genuinely feel it. And for me, that is the ultimate gift with healing
It's
is to
huge.
be happy.
It's like I feel the same way. It significantly impacted my life
Yeah.
and for the better. Like I said, I was self-isolating. I'm not self-isolating anymore. I
Yeah.
don't carry around this deep shame to the point that I feel disgust, that I feel like I need to vomit, right? Like,
Yeah.
yeah.
It's it's such a powerful experience, and it's powerful because of the connection.
And you learn so much and you grow so much through
Yeah.
doing these sessions and you learn so much about yourself
Yeah.
and you grow. Like the more sessions you do, it's just like you grow as a person because you're learning and you're just going deeper and deeper. And it's just amazing.
Yeah, I agree.
And um, statistically, it's very common for people to get PTSD
Yes.
after sexual assault. What are some of the protective factors that can prevent people from getting PTSD?
I think the biggest protective factor is a felt sense of community, a felt sense of connection, such as, for example, when you were talking about the tribe. having our own tribe where we can come to and say, hey, this is what happened, and being able to be honest and open and vulnerable and say, hey, this is what happened and this is what I need. I think a lot of us, especially in Western culture, in Western civilization, we lose our ability to say what we actually need and to ask when we need something important. I know a lot of trauma survivors, a lot of sexual trauma, especially, it goes unhealed for so long. And I think that the ability to have this, oh, I just saw a little
Little
animal.
puppy? That's my 7-month-old puppy. You
Uh,
said I'm worried my cat might come in the interview, and there he goes with my puppy.
yeah, my cat saw a bird outside, so he's running around yelling yelling at the birds, which is just another glimmer for me because I love that little noise that the cats make when they're, yelling at the birds like they're gonna go fight or go do something. Um, but sorry, coming back, a felt sense of community and connection, right? I think that is going to be the number one buffer for PTSD. The second is getting treatment, especially somatic treatment, as quickly as possible. Trauma is something, it's such a powerful force. It literally changes our brain structure. Years of trauma, years of our amygdala shooting off cortisol will alter our brain chemistry. If we can mitigate that at an early stage, it will significantly decrease the impact of trauma on the body. And I think that being able to orient to safety, especially after trauma, because two people can experience the same trauma. One of them might develop PTSD, the other one might not. And when we think about these two different people, the capacity to experience traumatic energy is so important. And capacity is one of these things that's often talked about in SE sessions, SE training, our capacity for experiences. My SE facilitator that I often work for and assist under, Mashid Hager, she talks about it as a fruit bowl. And if you have a fruit bowl that's this small, if you have traumatic events that get plopped into it, you're not going to have a lot of room for growth and healing. And through SE treatment, through SE sessions, we slowly and gradually grow this fruit bowl to increase our capacity to experience both positive and negative things. So if I have a fruit bowl that's this big and something really bad happens, sure, it's going to impact me because it will. It has to. But it might not lead to lasting psychological and physical damage, which is what PTSD is. So for clients coming in, our ultimate goal is not just to have them feel better, but it's to build up their capacity to withstand life.
I agree. Same with embodied processing is building the capacity so that when events do happen, we're able to handle it a little bit better, right? And maybe we're going to be, or when we are triggered, we're going to be able to come back into our bodies and we're going to be able to self-regulate
Yeah,
better than we were able to. So that doesn't mean we're not going to ever feel sad again or never feel anxiety again,
no,
right? No one, if someone's trying to tell you that, it's not going to happen, right? We
no,
will still feel anxiety. We're all human. We're all going to feel sad. We're all going to feel anger, but we're going to have the capacity to be able to handle it, to be
yeah,
able to deal with it. And it's not going to come on as strong or as long.
yeah. And I think that's exactly what I want everyone to know is that healing does not mean that you will never be sad again. Something truly terrible happened. You will be sad, but can you be sad without shutting down? Can you be sad without going into overwhelming anxiety and stress? That's what healing is. The capacity to experience what life has to throw at us without shutting down, without being so overwhelmed by it. Life is hard.
It is hard. And that's why it's good to have people that are there ready to support you, and you can support them,
Yep.
right? It's a teamwork. All right. And I have a lot of clients coming in with sexual trauma and they're feeling emotionally numb.
Yep.
So for people that don't know what it means, emotionally numb means they're not feeling any emotions or very low emotions. And it's not just sad or depressed or anger or anxiety. It's also joy and peace. When
Yeah.
we feel emotionally numb, we don't feel emotions. The positive, or if there's a positive, negative emotions, I don't really consider there's positive or negative emotions. They're just neutral.
Yeah.
Um, but when we do become emotionally numb, it's from severe trauma.
Yes.
And how do you help people with this?
So emotional numbness is so closely parallel with this experience of disassociation. Disassociation, derealization, depersonalization, these are all symptoms of freeze, of a freeze response within the body. So, what I will do when a client comes in, I have a client in mind right now who very, very quickly goes into freeze. I'll ask him, can you feel any part of your body? No. Okay. How about your chest? What's going on in your chest? Nothing. Okay. What about your feet? Well, I guess my feet are tingling a little bit. Awesome. Cool. Let's go there. If it's a little bit different, I go there. And I say, okay, even if it's like the tiniest feeling, let's go to this different experience. And for clients like this, that the emotional numbness can be so overwhelming, I try really hard not to ever shame them into making them feel like they should feel something. I'll often say, this is something that I'm feeling in my body as we're talking about this story. Is this familiar? Is this my feeling or is it your feeling? And with this client specifically, I found that working outside of the box is the most helpful. With this client, I'll often draw with him because drawing is something that brings him actual joy. And when we're so emotionally numb, we need to find our glimmers. And as we're drawing, I'll ask him a question, from time to time, like, yeah, what are you noticing in your body as we're drawing? What are you noticing as we're doing this in tandem? And I really frame it as we're doing this project together. We're doing this activity together. It's not me watching you. It's not me kind of sitting here. No, I'm terrible at drawing, but I will 100% draw if it will be helpful for the client. And when they start shifting away from freeze, I'll ask them, how do you want to feel? What does happiness look like for you? What does happiness feel like for you? Because it's different. Happiness and joy, it's different for everybody. It's a very deep, very personal experience. And if the client's able to share, I want to feel like this again, I'll ask them, in the last 72 hours, have you felt this? Well, no. Okay. How about the last week? No. How about the last month? Actually, yeah. When I was walking with a friend, there was a dog that came up to me and I felt like joy. I felt like I wanted to pet the dog. Awesome. Let's go back to that. Let's go back to that moment and let's just notice in your body what it's like to pet this dog, to be walking with a friend and then a dog just comes up out of nowhere. What's that like for you? I think it's so easy for us to get stuck in this emotional numbness, this freeze response, and noticing and coming back to this idea that the body naturally pendulates between these different states. And we just got to catch it.
Okay. I agree. And yeah, I know even like Peter Levine, he said um to look at an old photo
Yeah. Hmm.
and just be aware of like family, friends, whatever, a significant photo album that's
Yeah.
significant to you, and just notice if anything happens in your body, even something small.
Yeah.
And then, and yes, and also like walking through grass with bare feet, walking through the ocean,
Yeah.
holding an ice cube and noticing all the edges,
Hmm.
and just noticing how that feels in your body. And even eating
Yeah.
or drinking, like the first few sips or the first few bites. Notice it, how it tastes. Notice how it feels going down your throat and into your belly. Notice how it smells, noticing all aspects of it.
Yeah.
And if you do that with every meal, just the first few bites, the first few sips, and practicing this every day, right? Noticing that sunset. Or if you enjoy nature, spending that time in nature, right? Do what
Yeah.
you love. Do what you love. And when you're doing it, just like that man is coloring, notice what's happening in your body,
Yeah.
right? Because often it's happening. We're just so not in our bodies that we're just not noticing it, right?
Yeah.
And with North America, at least, maybe more, and I'm Canadian, very much. I notice myself, I have to bring myself constantly back into my body, right? Um, and that's okay. It's just constantly, okay, oh, I'm back in my head. Let's go back into our body. And I know one of the best pieces of advice, I had a hard time going into my body.
Hmm.
And one of the best pieces of advice my friend Christian told me was throughout the day, a few times a day, just stop, close your eyes, and just notice. Just take a few moments and just notice, see if anything's happening,
Yeah.
right? And the more you do that, the easier it becomes.
Yeah.
And then you start to feel more and more sensations because our body, it's like another way of communication that our bodies are trying to speak to us. And we can learn a lot by
Yeah.
listening. And what advice do you have for us, for the viewers?
Oh, for those viewing this, and perhaps you are a survivor of sexual trauma, or perhaps you know someone, you're not alone. You're not alone in this. Sexual trauma is this experience that is one of the most isolating, one of the most lonely experiences because our body is taken by someone else. Our container, our vessel is taken by someone else. And that can lead to so much shame, so much shutting down, so much disconnection. But you're not alone. And finding and allowing other people to support you, whether that's friends, whether that's online groups, blogs, chat rooms, whatever it needs to be, healing has to happen in community. You do not ever need to go through this alone. And even though it feels, especially if it was an early childhood experience, it may feel like, well, this is just my life. No, it doesn't have to be. Healing can happen at any moment in life. I have a client who came to me when she was 79 for childhood sexual trauma.
79.
79. And she wants to heal and she wants a different life. She has such a hard time connecting with her husband. They've been married for longer than I've been alive, but she has such a hard time connecting and feeling safe. But she wants that. Everybody wants that, and there's no deadline to get that. There's absolutely no deadline. You do not have to suffer in silence ever. There is help out there.
Okay. Well, thank you so much. And I think what you just said applies for people, not just with sexual trauma, but with trauma, any type of trauma.
Yeah.
Would you agree?
Oh, 100%. Trauma, especially, is one of those experiences that needs to heal in community. We try so hard to be the strong one, to fix it ourselves. That's not going to work. Trauma is something that needs to heal in connection because trauma in and of itself, its essence, is an interpersonal experience most of the time. There's some offshoots that aren't, yes, like getting hit by a car, for example. Like, it's not interpersonal, but most traumas are interpersonal experiences, and they need to heal in connection, in relationship with someone else.
Okay. Well, thank you so much.
Thank you so much for having me.
It was an honor to have you.
Thank you.